Hi, I'm Dr. Matthew Fury. I'm a shoulder, elbow, and sports medicine surgeon at the Baton Rouge Orthopedic Clinic in Louisiana, and we're very grateful for AJSM for selecting our article to be highlighted from the current issue. This work was done at the Shoulder Biomechanics Lab at the Hospital for Special Surgery, and it was entitled The Effect of Capsular Repair Location on Humeral Head Position and Translation After Distal Tibial Allograft Reconstruction. And we sought to approach the clinical problem of large glenoid bone defects and the surgical procedures to restore glenoid width, in particular the distal tibial allograft. And there's been a few different techniques with the management of the anterior capsular labral tissues, whether repairing to the native glenoid or to the graft. And so we utilized 9 cadaveric specimens on a shoulder table with a KUKA robot. And in our study, we found that repairing the anterior capsular labral tissues to the native glenoid caused a posterior shift in the humeral head resting position and a significant decrease in anterior translation compared to the native state. And so the major takeaway from our finding was that surgeons, when performing bone block procedures for large glenoid bone defects, should be intentional and thoughtful with their management of the anterior capsular labral tissues, because at least at time 0, there's a potential for causing overconstraint in the glenohumeral joint.